Hello everybody. For this Antibiotic Awareness Week, I want to tell you a few words on behalf of the Alliance for the Prudent Use of Antibiotics, the APUA, that I have the honor to chair. You are probably all aware that to prescribe drugs or to give drugs to a patient if you're a nurse is something very important, and you have to make sure for any drugs that it will be beneficial for your patients. But for the specific topic of antibiotics, the impact may even be more important because, as you know, the antibiotics are fighting living organisms, the bacteria, and they tend to develop resistance each time we use antibiotics. So this difference as a consequence is that any time we use antibiotics, we may have impact not only on ourselves or the patient microbiota, because he will develop resistance, he may develop resistance any part in his body, but also for his relatives, because bacteria can be transmitted and resistance to bacteria as well, and even for the next generation. And as you probably are all aware, we are facing a big epidemic of antibacterial resistance in many parts of the world, and it has become much more difficult to treat simple disease such as otitis or even cystitis, urinary tract infections in some places because of this emergence of antibacterial resistance. And although for most drugs you will be with the same efficacy 50 years after they were developed because they didn't lose their efficacy, for antibiotics we are experiencing a big loss of the efficacy of some antibiotics because of this emergence of resistance. A few years ago, the former director of the WHO Health Organization warned our attention on a very important point. This threat of the emergence of antibacterial resistance will not only affect the treatment of infectious disease, but it may also affect many other specialties in medicine. Because if you want to treat a complex cancer, complex malignant hemopathy, or if you want to perform complex surgery, to perform solid organ transplant, you have to make sure that you will be able to protect your patient if they get infected. So if the emergence of antibacterial resistance goes up to a certain level, we will not be able to perform this very important intervention anymore. So the main message for this Antibiotic Awareness Week is that you have to consider antibiotics for what they are, very good drugs that we really need for many topics in medicine, but we have to use it properly, because if we use it in excess, in situations where they are not necessary, we will contribute to the emergence of antibacterial resistance, and the treatment of many diseases will become much more complicated for the next generation. So please be aware that antibiotics have to be used only when they are required. Thank you for your attention.